Today, I am so fortunate to be joined by my good friend Beth Greve, who I've known for many years when we worked together in the entertainment industry and we surfed in Venice Beach together. Well, when she was 49, she unexpectedly had a stroke, and this led her to become an ambassador for the American Heart Association. And she is now head of the Global Partnership for Iron Mountain Entertainment Services. Dr. Magliato is one of the few female cardiothoracic surgeons in the world. She founded and directed a multidisciplinary women's health center to address the cardiac needs of female patients at Providence St. John's Medical Center in Santa Monica, California, where she is still currently on staff. Prior to joining St. John's Medical Center, Dr. Magliato was a heart lung transplant surgeon and director of the Mechanical Assistant Device Program at Cedar Sinai Medical Center in Los Angeles. Her memoir, Heart Matters, was made into a scripted TV drama, Heartbeat, on NBC. Welcome, ladies, to the new mid.
Thanks.
Thank
Good to
you.
be here.
Dr. Magliato, before we dive into women and heart disease, I wanted to ask you, Beth, could you tell us your story? What happened when you experienced having a stroke? I was just so surprised to hear about it because you're one of the healthiest people I know. I mean, I know you don't smoke and you eat so healthy. So, what happened?
Yeah, it was a shock. I actually didn't know I was having a stroke, which is one of the reasons why I really wanted to join and help the American Heart Association and the ASA, because a lot of people like myself would never expect to be having a stroke at 49 in the middle of the day while you're reffing a soccer game. I was, I had some blurred vision on my right side on and off, and I just thought I was dehydrated because, I'm out there reffing a soccer game. And then I lost peripheral vision on my right side again, once or twice during the course of a day and a half. And at one moment, as I was moving my mother-in-law into her new apartment, I got a phone call and I was chatting with someone, and I completely blacked out, do not remember the call whatsoever. It was 1:00 in the afternoon. And I didn't pass out. I just have absolutely no memory. And that was the moment when I called my doctor and said, something's up. I got to come talk to you. And I'm very lucky. And then the symptoms ended. But I'm very, very lucky that I am okay. And I think it's because I'm healthy, but I ended up with a condition. Many strokes are actually caused by heart conditions, which is why this partnership of the AHA and the ASA is so critical. And I had what's called a PFO. And when you're born, every baby that's born, the umbilical cord, inside the womb feeds you through your heart. And when you're born, that breaks off and there's this little flap in your heart. And I'm going to give the layman's terms and the doctor's going to correct me. But anyway, I had this condition, and there's this flap between, your two main ventricles of your heart. And mine, apparently 20 to 25% of people still have this flap, and it doesn't close 100%. And mine was, of course, a 5+ out of 5, as I like to say, because I do nothing small. And it opened on every single breath. Wow. And it was very large. And so what happened was a small blood clot got through that hole, and the blood goes straight up to your brain and sat up there. And ultimately I had a stroke. So wow. I couldn't to say I'm happy to be here is beyond the norm.
So are we. Oh my gosh. Dr. Magliato, I was wondering, I was shocked when I heard, I thought women mostly died from breast cancer or from uterine cancer. And then I learned we are killed mostly by heart attacks.
Yeah.
Why is that?
Yeah. Heart attacks and stroke, like, what Beth has brought up. And by the way, Dr. Beth, you're Dr. Beth now. That was a beautiful explanation of a PFO, which is a patent foramen ovale, which is again a congenital heart issue that led you to have a stroke, which thankfully you've fully recovered from. I mean, sadly, a lot of people don't. Yeah. And to Michelle's question, heart disease and stroke are linked. Many of the causes of heart disease are also the causes of stroke. Many of the risks for heart disease are the same risks for stroke. And what we're seeing, Michelle, and here we are with Beth, that you said 49, right, for your stroke.
Yeah.
What we're seeing is this shift in a lot of younger women now developing what we call cardiovascular disease, which is heart disease and stroke. And it's quite alarming. And some of it has to do with what you brought up, Michelle, which is awareness. A lot of women don't know what you just said, which is the fact that heart disease and stroke kill more women than all cancer combined. So if
Wow.
I take, you mentioned uterine cancer, you mentioned breast cancer, if I take lung cancer, which is the most common cancer in men and women, colon cancer, pancreatic cancer, and I combine them, it doesn't even come close to the number of women dying of cardiovascular disease. And in fact, heart disease has actually killed more women than men every single year since 1984. So this is an epidemic among women. And by the way, it's great today to finally talk about some other form of death besides COVID, though I hope we get a chance to mention, that COVID and heart disease are also inextricably linked. But yes, thanks for bringing up that point about young women and awareness about cancer versus heart disease.
Well,
And
it's
I'm happy
interesting.
oh, sorry, Michelle. I was just going to say, I'm happy to hear you talk about the awareness, because when I told my story on social media, the first thing that everyone said was they were completely shocked. They're, because I am very active, as Michelle mentioned, we ski, we surf, we ride mountain bikes, we're constantly doing something. And I think that's the other key component here, is that it can happen to you, even though you're not smoking, you're not doing drugs. You know what I mean? You can be a quote model fit citizen and still have, a condition that you're completely unaware of. And that's the key piece.
Yeah.
Well, I see the movies, right? We all see the movies where the man gasps, he clutches his heart, he collapses, right? We all know that. So what are the symptoms? I know, Beth, you mentioned some symptoms, but what are generally the symptoms that we should be looking for?
Well, just to speak to heart disease for a minute, and you're right, that quintessential, on television heart attack, shoveling snow in your driveway and clutching your chest, that is absolutely not how women present with heart disease, which is really one of the most shocking things I think about women and heart disease, is that, almost half of us have no chest pain whatsoever. So if you're waiting, for your chest pain moment to be your heart attack, that's actually incorrect. Most women get more subtle symptoms. The most common symptom that women actually get for heart disease is actually fatigue. I mean, ladies listening to the podcast, raise your hand if you're exhausted. We all are. But this fatigue is sort of an uncanny fatigue. It's a fatigue where women say, something's not right. I'm exhausted all the time. I'm getting sleep. I'm exercising. I'm eating right. But I just don't feel right. And what I love about women is we're very in tune with our bodies. We know that something's wrong. And so this fatigue, especially when it's accompanied by shortness of breath, is really a double combination that we look for in heart disease. Additionally, women get jaw pain. They get pain that goes down their arm. They get nausea, upset stomach. A lot of women get that type of a symptom, and they would have no idea that this is heart disease, none whatsoever.
No, they don't seem like they're related at all.
Yeah, they don't seem like they're related. A lot of women, I've actually done surgery on women that have like a gallbladder scar where someone took out their gallbladder thinking they had, a gallbladder issue, when it turned out to be angina. I remember there was also one woman who kept getting jaw pain. She kept going to her dentist. They kept pulling out teeth and doing all this gum stuff. And it turns out that was actually angina, which was jaw pain. So again, women realizing that chest pain is not the symptom that they typically get is really important to recognize. And of course, if you have those symptoms, the most important thing, and it's probably what saved Beth's life, is not to ignore it. Because honestly, Michelle, that's what we do. We get these symptoms and we're like, oh, I'm tired and I'm a little short of breath. Maybe I'm out of shape. We justify it. And it's why most women die at home with heart disease. They don't even make it to the hospital, which is quite scary. And oftentimes the number one way that women present with heart disease, believe it or not, is death. They come in
Wow.
dead on arrival.
Oh,
They
that's
ignore
awful.
these symptoms. It's quite shocking in heart disease.
Well, it's interesting that you say you have arm pain. Is there a certain arm that, because you've heard that before, is there a certain arm that you feel that pain? Is it a different type of pain? What kind of pain is that?
It's
Just
it's
curious.
typically left arm pain, but Beth, didn't you say you also had arm
No, it was peripheral vision.
also
Yeah, it was
peripheral,
all, mine
Perfect.
was all related to the right side vision scenario.
and it didn't affect your limb at all?
No,
Yeah,
no,
that's unusual because stroke also can present with,
yeah,
a functional loss of a limb, of half your body, your facial
thank goodness.
musculature, that type of thing as
Yeah.
well.
I mean, I
Yeah.
will say, like, my doctor now, who's phenomenal, he's a general practitioner, but now he calls me the weirdo. He's like, well, you're the weirdo that gets all this weird stuff that we never expect because your blood tests are all good, like everything, you're fine. But when you see a picture of your brain with black spots on it, it's
Yeah.
a serious awakening, right?
Yeah.
That like this can happen to anyone. And as I mentioned, when I was posting, I'm shocked that more people don't test for this because it's not a complicated test to see if you have a PFO. It's pretty simple.
Yeah, you can get
Bubble
something called
test.
an echocardiogram, which is probably what you had, which is like an ultrasound of one's heart. And it's similar to, women who are pregnant, they ultrasound our
Yeah.
abdomens and they look at babies. It's the same type of test only for the heart. And the American Heart Association, speaking of, sort of preventative care and especially in young women, we recommend that you go and get a cardiac evaluation starting at age 20. And that echocardiogram, to your point, Beth, should be part of that assessment because it looks structurally at the heart. A lot of women go in and they get an EKG and their doctor
That
says,
doesn't
"Oh, your
show it.
EKG is great, you're fine." Okay, that is not enough, ladies. So you all should be asking for, blood work and some of these tests that look at the structural function of the heart. An EKG is important as a baseline measurement, but it's not really a good diagnostic screening tool if you don't have symptoms. So there's certain things that we need to be advocating for our own heart health, because a lot of times again, with our health, we just blow it off because probably, Beth, you can attest, and even you, Michelle, that you're so busy taking care of everyone else that the last person you take care of is yourself.
Mm-hmm.
Yes,
So,
absolutely. That's exactly what happens. And I think it is easy to ignore it because we're tired anyways with everything that we're doing.
yeah.
So do we need to have good cholesterol health? Is that one of the things to prevent as well, to help us prevent getting a heart attack?
Well, heart attack and stroke. So I think maybe it'd be a good idea to just talk a little bit about risk factors, especially because, for Beth, she had a complete paucity of any of these risk factors, though she had this congenital hole in her heart, this abnormality, that sort of flies under the radar of the risk factors we'll talk about. But, there are several risk factors that we can do something about. And that's where the prevention piece comes in. The foundation upon which we have built everything that we do at the American Heart Association has to do with mitigating that risk, right? So heart disease isn't cancer. It's a disease that's 80% preventable, 80%. And yet it's the number one killer of men and women in the world, which is to me, mind blowing. So there's two risk factors that you can do nothing about. One is your age. So ladies, when you hit the age of 55 or greater, you automatically get a risk factor you can do nothing about. You can get Botox, you can look fabulous, you can look like you're 25, but if you're 55 or older on the inside, you get a risk factor you can do nothing about. The second piece is family history. So if you have a family history of heart disease, and when I mean family history, I'm talking about first degree relatives, mother, father, brother, or sister that has had cardiovascular disease, so heart disease and stroke, that also gives you a risk factor that you can do nothing about. You can disown your family, but you cannot disown those genetics. But the risk factors that we can look at, that we can mitigate, are the ones that most of us know these risk factors. And the big ones are high blood pressure, diabetes, smoking, obesity, which, by the way, has now become a really critical risk factor, especially with COVID now, indiscriminately attacking people who are obese, and as well as sedentary lifestyle and stress. So these are all risk factors that we can do something about. And if you go to the American Heart Association website, it will explain a lot of these risk factors to you. And we have this new risk scoring system called the American Heart Association Risk Calculator that you can put in all of your potential risks. It does require you to have some blood work, and to get back to what you were saying, Michelle, cholesterol and knowing your good cholesterol, your HDL, and total cholesterol are part of that risk calculator, right? So knowing those numbers is required, and you can calculate your own 10-year risk for heart disease. So
that's fantastic.
All of these are important risk factors to be able to mitigate.
All right,
That's
so
fantastic.
everybody go get that done so you can
Go get it done.
go make it happen.
I love that. Well, I wanted to talk to you. I know our risk goes up at 55, but the American Heart Association has recently done a study that's actually shown that women ages 35 to 54, and Beth, you were 49, that heart attacks and stroke are on the rise. Why do you think this is the case?
I think part of it is awareness. I think that there's a complete lack of awareness in this patient population. Again, something that, we have really worked on it at the AHA, the American Heart Association, to build this awareness amongst these groups of women. We have a whole campaign around it called the Go Red for Women campaign. The other piece of it is, again, not knowing those risk factors. And I think the two biggest ones with women in that age group are smoking. And when I mean smoking, I'm talking about cigarettes and vaping. Okay. A lot of young people think that vaping is I'm going to put it in laser quotes, healthy alternative to smoking. And it is not. Okay. So smoking and vaping in that population, I think, becomes really critical. And the other thing is obesity. We have this epidemic of obesity in the United States, with 70% of our population either being overweight or obese. And it's in a younger and younger population, starting now with young children. And I think those are some of the drivers for seeing this type of uptick in heart disease in younger patients. It's alarming. It really is.
Well, I'm sad. I'm sad about that, but I'm really looking forward to trying to get more people active right now as a woman of impact with what I'm trying to do is get everybody to remember recess. So go rock your recess, right? Remember when you were in school and it was like, woohoo, it's recess time, we're going on the playground, and you're going to jump rope, or you're going to climb, or you're going to play tag, or whatever it is you're going to do. And I'm going to encourage people, or I am encouraging people, to get out there and rock whatever their recess is. If you want to hula hoop, if you want to go for a walk with your neighbor, if you want to swing a tennis racket, kick a soccer ball, just be active and do something that's going to make it feel like recess. And it doesn't have to be, again, to your air quotes, working out. I don't like to go, but right? Go have fun.
Bring back the play. I love that.
Bring back the play.
Bring back the play.
Exactly.
And Beth is right. Beth, it doesn't have to be that high intensity type of workout. Our recommendation is that you exercise, and you said walking. Okay, walking's a great exercise. That we exercise most days of the week, so 4 days out of 7, and we'd like to see about 150 minutes of exercise a week. And that usually isn't that difficult to attain, but you have to be on it, and it calls for you putting yourself first and saying, today is my day to spend 30 minutes, walking and exercising. And I think that's really critical, especially now that most of us are doing what we're doing right now, which is sitting in front of a Zoom camera. It really makes it even more important to get up and recess. I love that. I'm going to steal that. Can I steal that?
You can, but you have to use the hashtag rock your recess every time you feel it. And that's going to be our thing. We're going to, Yeah,
We're gonna
great.
get it. We're gonna get it trending, Beth. We'll get it
Yes,
trending for
trending
you.
Dr. Recess, totally.
Well, Dr. Magliato, I wanted to talk to you. You've mentioned a lot about COVID, and COVID-19 has just rocked and changed everybody's world. And we're finding out that a growing number of studies suggest that many COVID-19 survivors experience some type of heart damage. And even if they didn't have underlying heart disease and weren't sick enough to even go to the hospital, this is really worrisome. Can you tell us a bit more about how COVID is affecting our hearts?
Yeah, it's very frightening. When COVID first came out, everybody was jumping on the bandwagon of this being a viral pneumonia, right? Because we saw these patients on ventilators and having respiratory distress. And then some interesting data started to come out. Initially, the data came out from China because, of course, the virus started there, it hit there before the US. And some of it was autopsy data. So as people were dying, and then we were sort of, looking inside these people, we noticed a very, very interesting phenomenon. And that was that the virus wasn't just simply attacking the lungs like a pneumonia, it was actually attacking blood vessels. So you have about 60,000 miles of blood vessels in your body, right? If I were to sew them together end to end, they would wrap around the world twice. So this huge network of arteries in your body that most people aren't aware of, it turns out it's actually one of the biggest organs in your body, because every millimeter of every mile of those blood vessels is coated with an inner lining called the endothelium. And the job of that endothelium is to really protect your blood vessels from developing disease that leads to, like we're talking about today, heart disease and stroke. And so the health of that lining, this living lining, is critical. And we found that what the virus was doing was literally attaching itself to that lining and causing inflammation and destroying the lining, and also causing what Beth had, which was blood clots. Because one of the other things that lining does is it not only is protective, but it also prevents your blood from clotting inside your vessels. So there's a lot of data now showing that it's attacking the lining of the blood vessels to every organ in your body, including the heart, and causing a massive inflammatory response. We're seeing it in children, which is an emergence of this pediatric inflammatory syndrome. It looks a lot like something called Kawasaki disease, which used to be a very rare inflammatory vascular disease. We are seeing it manifest in adults who are having what are called large vessel occlusions, which are massive strokes. So unlike, thank God, the smaller stroke, that hopefully smaller, Beth, that you had, we're seeing huge hemispheric strokes where you basically clot off half of your brain. These are very rare. They're now becoming more commonplace. We're seeing smaller levels of stroke, smaller vessel occlusion, limb loss. You've probably heard about some people have had limb amputations from blood clotting in their limbs. COVID toes are small blood clots to the toes. COVID rash is small blood clots to the skin. And so it's essentially a complete attack of the cardiovascular system. And so these patients who get COVID, when they do recover from it, they have, sadly, this residual effect of being, some of them, incapacitated on a cardiovascular level from COVID. You're seeing it a lot of times in professional athletes who can no longer perform because they have, some form of heart inflammation that's causing their heart not to function well, or residual shortness of breath from an attack on the blood vessels of the lungs. And that's what's so scary. So COVID is a cardiovascular virus, not simply a respiratory virus. And that's an awareness piece that needs to be shouted, in my opinion, from the rooftops to people with COVID. That's how dangerous this virus is.
I have not heard it articulated that way once. I'm so glad you just said that, because I had absolutely no idea.
Yeah. If you just Google COVID and endothelial disease or endothelial function, you'll see it.
I'm gonna have to learn how to spell that, but yeah, I will.
Yeah.
I'll put it in the show notes so that people can
Exactly.
click
And
and like go to it, which
Yeah.
I think this is really powerful and really important, because people, there's so much misinformation out there, and we need to get the correct information so people understand what exactly is going on. You talk about children, this is going to affect them for the rest of their lives, and we still don't know what the side effects are going to be. So thank you so much for talking about this. If someone I wanted to go back just a little bit, because I am not a surgeon. I know you're all surprised by that. But so for those of us who are not heart surgeons, can you explain to us, when we have a stroke, a heart attack, what exactly is happening to our hearts? And what are the options, so that if there are women out there, say they listen to this and then a day or two or a week or a month later, something does happen to them, they understand what is happening and what their options are.
Okay. So heart disease and stroke are very similar in their, so what we call pathology or pathophysiology. The beauty of the human heart is that it's a muscle like every other muscle in your body, and it has its own beautiful blood supply, which are called the coronary arteries. These are arteries specifically that supply blood to the heart, right? Much like the brain has something called cerebral arteries. These are arteries that supply blood to the brain. And every organ in your body needs this blood supply for its nourishment to stay alive. What happens with a heart attack or a stroke is that disease occurs inside these blood vessels. Think of them like pipes, if you will. And that disease happens on two levels. Either you develop cholesterol buildup and plaque buildup inside these arteries, much like junk builds up inside of a pipe, and it narrows these arteries until you lose blood supply to the organ. If that happens to the heart, that's a heart attack. If it happens to the brain, it's a stroke. With the caveat that the other thing that can happen, which is what happened with Beth, is that a blood clot can also form in these tiny arteries. We're talking about arteries that are like 1 or 2 millimeters in size. And that clot blocks off all blood flow, which again, if that happens to the heart, it's a heart attack. If it happens to the brain, like in Beth's case, it winds up being a stroke. So, recognizing the symptoms, to answer the second part of your question, and doing something about it is critical. The most important thing you can do is get to a hospital. If you're having these symptoms, we would rather that you come into the hospital and, be ruled out for a heart attack or a stroke than have you stay at home. And I'll tell you, women were the worst at it, right? Women, I've had women, I swear to God, I had a woman once come into the hospital having an active heart attack. And she said, I just kept taking, nitroglycerin pills that she had, for her known heart disease. And I said, well, why did you do that? She said, well, I had to throw a load of laundry in before I came in. I was like, okay, that is not right. That's not good multitasking. Yeah. So what I see is women, they don't call 911. They drive themselves to the hospital. So Beth, I'm going to ask you, did you drive yourself to your doctor?
I did. Yes.
You did? See, they drive themselves to the hospital, and I swear they'll pick up 2% milk on the way in. This is the multitasking of a woman, got to get milk on the way to my heart attack. So ladies, I'm telling you, with men, it's a whole different gig. Men call 911. They come in with an entourage of family members. It's a whole show. So that is why the most important thing that you can do is, you're developing these symptoms, is to call 911 and come to the hospital so that we can evaluate you to make sure you're not having a heart attack or stroke. There was, I'll finish with this one story. There was a great study done in New York City where they surveyed a bunch of women who had heart attacks and drove themselves to the hospital, right? And they asked these women, why did you not call 911? Do you know what the number one answer was?
They didn't want to bother them?
Well, you would think, but the number one answer turned out to be that my house was dirty. They were worried.
Oh my gosh.
I'm like, just keep your house clean, call 911, have the
Oh.
fabulous EMS fire department come to your home. I don't care what it looks like, and come to the hospital. Okay, ladies,
Wow.
don't drive yourself.
Oh my
Well, I
gosh,
will
I
say
love that.
I'm completely guilty of having symptoms, being uneducated, right? Uneducated that I don't get migraines. And, I had this little headache. And then again, I was like, oh, I'm roughing on the soccer field. I'm like, oh, I'm dehydrated. That's it. I'm just dehydrated, self-diagnosing, which was completely
Yep.
wrong, and waiting. And to
Yep.
your point, I should have gone directly to the ER. I should have gone in and said, something's not right. I don't feel right. I just completely forgot about, like blacked out on a phone call. I should have, instead of calling my doctor and making an appointment with with DeAndre who answers the phone, I should have gone to the ER, right?
Right.
And then I would have had all of my tests probably within 24 to 48 hours, and I would have known. Instead, it took 3 months, like to go
Wow.
through the medical process of what happened and all the tests I had to have, and it took a lot longer than it should have. And
There's a great video on this, Michelle, for your listeners and your viewers. It's Elizabeth Banks did it in concert with the American Heart Association, and it's called "Just a Little Heart Attack." And it's a great video about a woman having a heart attack and not going to the hospital. It's meant to be, she's got a great sense of humor. It's meant to be humorous, but it actually, drills that point home about, putting your heart health first.
Yeah. Well, and to your point, that's what we need to start doing more of, right? Exercising, eating right, not vaping, doing things that we know are bad for us, and paying attention, and not being, and not making an excuse about needing to go see a doctor or to the ER. I think those are key takeaways for me from your conversation.
And is there any last bits of advice you would like to leave us with, Doctor?
Oh, last bits of advice. So I think, Beth, you just hit all the major points. But again, I think, ladies, putting your heart health first and being an advocate for yourself is where I want you to be at. I think we've come upon a whole dawning of the age of women. And so many wonderful things are happening in our society with women. So, ladies, think about putting yourself first, getting your heart health checked. And if you could put it above everyone else's needs just for a moment to take care of yourself, that's what I would advocate for.
And that's the best way to take care of everybody, by being around and being safe and being healthy. Yep. Right? So go rock your recess, people.
Well, I love it. Thank you, ladies, so much for taking the time to talk to me. And thank you for everything you guys are doing with American Heart Association and bringing awareness. And I can't thank you enough for being part of this show. So thank you so much.
Thank you.
And great to see you, Dr. M.
Thanks. Good to see you, Beth. You look great. And don't forget, February 5th is Go Red. Wear Red Day for Women's Heart Health Month in February. So just to keep you aware.
Representing.
I think we should just wear red the whole month of February.
Let's do it.
Absolutely. I would love that.
Let's do it.
I think we should. That is so great. Thank you, ladies.
Thanks. Bye-bye.
Take care.